So I guess it all came to a peak point for me when I was pregnant on my third child. So this was in 2010 into 2011. I was really sick. I was finding it very difficult to manage just my day-to-day life. I was constantly on antibiotics, trying to clear chest infections and sinus infections. And I was taking steroids from time to time to try and help me with my breathing. So round about, I suppose, the summer of 2019, when they were readying me for my own, treatment plan, Deirdre, my respiratory nurse, who works with Professor Costello in Beaumont, she explained to me that the injections were going to do the job that the steroids did without the steroids being there. And I thought that was the best news I'd ever heard, because I was dying to get away from steroids. I have a bit of osteopenia anyway. Osteoporosis runs in my family, and I was concerned that the steroids were going to cause, irreparable damage to my bones. But I suppose when you weigh up steroid use, the negatives against the positives, when you're very sick and you can't go to work, steroids were good to help with that. So, they were a necessary evil. They also caused a lot of weight gain, probably about 2 stone in weight gain, and mood swings and constipation and various different things like that. So the steroids were not something I wanted in my life. It's almost 2 years now since, when I'm recording this, it's almost 2 years since I started. As I said, I've only ever used my blue inhaler twice in an emergency, in an asthma attack since then. So I've been a full year without steroids for the first time in about 15 years this year. One of the important things for me was being kept kind of informed about the treatment and what it was all about. I like knowledge, I like information, so I was able to read up on it myself, but I was also given a lot of literature in the hospital, and the team there in the respiratory room in Beaumont, there are 3 of the staff there that looked after me, and they were ready to answer any question. It wasn't just, read the leaflet, it was the care that they took to answer my questions, to explain what they had seen in other patients, what the likely outcomes might be, and not to give me false hope either that this was going to, change everything about my asthma treatment, but that, it could make improvements for me for the future. I think, suggestions, I suppose, to communicate about Fasenra or any of these precision medication drugs, and of this new approach, it would be very helpful to, have people who can talk to prospective patients about this. Perhaps it would be no harm to, put a little video up about this on the app or on the website, or have a facility for people to talk, like me, I guess, talking here, to patients, so that they see what it's about, and maybe to be able to explain what it's like as a patient, and that it's nothing to be scared of, and the impact that it can actually have on your life. So I'm here at SportsLink Gym. It's the gym in my local community, and it's great for me to be able to be back here. For many years I wasn't able to exercise at all, or if I did, very quickly, if I did a couple of sessions, I would get an exacerbation then a few days later, and I'd nearly be back to square one again, back onto steroids, back having to mind myself for a while. So it's been a really long road, but now I'm glad to say I'm slowly but surely getting back in and getting a little bit of running done again, which feels really good. Yeah, it's great. I'm sleeping, which was one of the things I really wanted to do, and I'm really sleeping much better now. And I just generally have an energy that I hadn't had for a long time. I had false energy from steroids, and I'd have that high and then that low, and I haven't got that anymore. I can't speak for everybody, and I'm sure that not everybody will have the exact same experience as I have had, but it has really been revolutionary for me. It really has changed my life.